Hello all. Today I am going to show you commonly used test tubes for collecting blood samples. The evacuated tube system for blood collection is in use for various laboratory tests. Test tubes comes in a variety of sizes, types, volumes, materials and caps in order to meet the differing needs of individuals and healthcare professionals everywhere. There are different types of blood collection test tubes are available in hospital for various diagnostic tests. Most of the blood collection test tubes contains an additive that either accelerates clotting of the blood or prevents the blood from clotting. A phlebotomist plays a major role in choosing the appropriate test tubes as per the diagnostic test ordered by the physician. The test tubes has different colored caps like red, yellow, blue, green, lavender, grey, black, etc. According to the type of test to be performed, we need to choose appropriate color test tube. The red test tubes are not commonly used. They are used for a series of biochemistry tests that requires serum. Commonly used additives are silica particles, which are going to act as the clot activators. These tubes are used in various serum testing, example glucose, triglycerides, cholesterol, HDL, potassium amylase, etc. The yellow tubes are used for blood as well as bodily fluid test. Commonly used additive includes anticoagulant SPS, sodium polyanethyl sulfonate, to prevent the clotting of the blood and stabilizes the growth of bacteria. These test tubes are used for test, example test of body fluids, example HLA, DNA and cultures, etc. The blue bottles are used for the hematology test, which involves the system of clotting and requires whole blood. Commonly used additive is sodium citrate. It helps in binding and removing calcium in order to prevent the blood from clotting. Common tests are PT, FDP, APTT, PTT, TT and factor assays. The green tubes are the most commonly used bottles. Commonly used additive includes heparin. It inhibits the formation of thrombin in order to prevent blood clotting. Commonly used laboratory test includes chemistry testing, ammonia, insulin, chromosome screening, etc. Next is the lavender tubes. These bottles are used for the hematology test where normally whole blood is needed for analysis. Commonly used additive includes EDTA. It helps in removing calcium, thereby preventing a blood clot. The test includes hematology testing, blood film for malaria, parasite, etc. Grey test tubes also are very common and are used for the collection of blood. Black tubes are used for pediatric ESR. Commonly used additive includes sodium citrate. This additive forms calcium salts in order to remove calcium from the blood sample. These are the various types of commonly used test tubes used for various diagnostic tests. To revise, red top tube has no additive and it is used for drug levels as well as blood bank. Red top contains EDTA as the additive and it is used for CBC, HbA1c. Green top tube includes sodium heparin as an additive and it is used for plasma chemistry. Grey top has sodium fluoride and it is used for glucose tolerance test as well as alcohol level. Blue tube contains sodium citrate and it is used for PT as well as PTT. Yellow tube contains ACD as well as SPS and it is used for whole blood determination. While using the test tubes, we must follow some specific instructions like blood should be aspirated up to the marked position on the label of the tube. And when we use a disposable syringe to collect blood, remove the needle from the syringe first and pour the blood slowly to the side wall after opening the cap. And carefully remove the luer adapter, scalp set, needle and so on after collecting blood in order to avoid needle stick injuries. And we must discard the needle, scalpel set as well as lure adapter after the procedure. Do not reuse blood collection test tubes, and standard precautions for handling infectious agents should be observed while collecting the blood. Wear standard protective clothing such as a lab coat and disposable gloves. And we must wash hands thoroughly before and after the procedure. Tubes and specimens should be discarded as biohazard waste. And do not transfer material from a syringe to a tube, and do not use quick blood collection tubes after expiration date, and do not use if the cap is opened, and do not use if there is any foreign matter present in the tube, and do not use if there is any breakage on the tube wall, and do not use if there is any visual water drop present in the dried tube. Do not use the tube if the solution in the citrate tube presents discoloration or precipitated, and avoid exposure to the direct sunlight. Contaminous diseases such as AIDS, hepatitis, which are caused by the needle stick, can be prevented by wearing protective clothing as well as gloves. These are some of the specific instructions we must follow while performing the phlebotomy procedure as well as while handling the test tubes.